Hello, everyone. I'm Mary. Many men don't seek medical attention until they experience severe dysuria, frequent urination, or even hematuria. By then, prostate problems have often progressed to the point where surgical intervention is necessary. Today, I want to share a health truth that may shock you. Regular ejaculation is actually the key to maintaining prostate health, and this frequency may be far greater than you. The overlooked life gland, the importance of the prostate. The prostate, a walnut-sized organ located below the bladder and surrounding the urethra, is a unique male reproductive gland. The prostate fluid it secretes accounts for approximately 30% of the total semen volume. This fluid not only provides nutrients for sperm, but also acts as a lubricant to help maintain sperm motility and motility. It can be said that this seemingly insignificant organ is the guardian of male reproductive health. However, in clinical practice, I've seen too many patients with serious misconceptions about prostate health. I was particularly impressed by a 65-year-old retired professor. While highly educated, he knew nothing about prostate health. He always believed that abstinence is the key to health. As a result, his long-term abstinence led to severe benign prostatic hyperplasia and urinary retention, ultimately requiring emergency catheterization. He lamented, "If I had known the importance of regular ejaculation, I wouldn't have suffered this." Recent statistics show that prostate cancer has become the second most common malignant tumor in men worldwide, second only to lung cancer. In 2020, there were 1.41 million new cases of prostate cancer in men worldwide. In my country, for example, in Shanghai, the incidence of prostate cancer surpassed liver cancer for the first time in 2015, ranking fourth among male malignant tumors, approaching those in developed countries in Europe and the United States. These data warn us that prostate health cannot be ignored. The scientific link between ejaculation frequency and prostate health. Many men may wonder, what is the relationship between ejaculation frequency and prostate health? Why is regular ejaculation so important? Recent medical research has revealed the key. From a physiological perspective, regular ejaculation helps the prostate detoxify regularly. The prostate secretes a certain amount of prostatic fluid daily. If this fluid accumulates within the gland for a long time, it can become a breeding ground for bacteria and increase the risk of prostatitis. During ejaculation, the prostate contracts, expelling this accumulated fluid. This process acts like a bath for the prostate, effectively eliminating potential pathogenic factors. More importantly, prostate contractions during ejaculation promote local blood circulation. A good blood supply not only provides the prostate with adequate oxygen and nutrients, but also promptly removes metabolic waste and inflammatory factors. Men who have not ejaculated for a long time often experience poor prostate blood circulation, which is also a major factor in prostate disease. A recent Harvard study published in the journal European Urology in 2025 further confirmed the link between ejaculation frequency and prostate cancer risk. The study, 1,925 men for 18 years, found that men who ejaculated more than 21 times per month had a 19% lower risk of prostate cancer in those aged 20 to 22% lower risk in those aged 40 to 49. This finding provides strong scientific support for the health benefits of regular ejaculation. Recommended ejaculation frequency for different ages. So what frequency of ejaculation is considered regular? Based on my clinical experience and the latest research, this frequency needs to be adjusted appropriately based on age, physical condition, and lifestyle. Young men aged 20 to 30 are in their prime sexual function and testosterone levels are high. During this period, ejaculating 3 to 5 times a week or even more is normal. I once treated a 25-year-old programmer named Xiao Wang. Due to a busy project, he had almost no ejaculation for 3 consecutive months. As a result, he experienced symptoms such as perineal pain and discomfort during urination. examination revealed acute prostatitis. After treatment and lifestyle adjustments, his symptoms quickly resolved. This case demonstrates that even with a busy work schedule, young men should not neglect the importance of regular ejaculation. Men aged 30 to 45 often face the dual pressures of career and family, and their sexual activity may decrease. However, this period is also the peak period for prostatitis. I recommend maintaining a frequency of at least 3 to 4 times a week. Mr. Zhang, a 38-year-old mid-level manager, reduced his sex life with his wife to once or twice a month due to a busy work schedule and childcare. He subsequently developed symptoms such as urinary discomfort and back pain, leading to a diagnosis of chronic prostatitis. With my advice, he adjusted his ejaculation frequency, and his symptoms significantly improved after 3 months. Men aged 45 to 60 are increased risk for benign prostatic hyperplasia (BPH), and maintaining an ejaculation frequency of 2-3 times a week is particularly important during this period. Mr. Liu, a 52-year-old executive, is a typical example. His BPH caused him difficulty urinating, requiring him to wake up 3 to 4 times at night, severely impacting his sleep quality. While taking medication, I recommended that he maintain regular ejaculation. 6 months later, a follow-up examination revealed that his prostate had not increased in size and his urination symptoms had improved. Men aged 60 and over, despite experiencing decreased sexual function, should still maintain a reasonable ejaculation frequency, ideally once or twice a week. My 68-year-old patient, Mr. Chen, was diagnosed with early-stage prostate cancer. While receiving treatment, he consistently ejaculated once or twice a week. A year later, his prostate-specific antigen PSA level remained stable, and his prostate cancer showed no signs of progression. This demonstrates that age is no excuse for neglecting prostate health. It's important to emphasize that these frequency recommendations are only guidelines. Each individual should adjust accordingly based on their individual circumstances. If you experience discomfort like fatigue or back pain after ejaculation, your frequency may be too high. If you experience chronic lack of desire or difficulty ejaculating, you may need to see a doctor to investigate for underlying health issues. Scientific understanding of ejaculation methods, breaking down additional myth. When discussing ejaculation frequency, we can't ignore the method itself. As a urologist, I often encounter patients who harbor misunderstandings and shame about masturbation. In fact, from a medical perspective, whether ejaculation is achieved through sexual intercourse or masturbation, the effects on prostate health are similar. The key is to find a method that works for you and strike a balance between your health and your psychological well-being. Mr. Xiao, 35, is a typical case. He had been separated from his wife for a long time due to work, but he insisted that masturbation was unhealthy. As a result, his long-term abstinence led to chronic prostatitis. After several conversations, I explained the medical significance of masturbation to him and recommended that he ejaculate 3 to 4 times a week. 3 months later, his prostatitis symptoms significantly improved. He later told me that after overcoming his prejudice against masturbation, he not only improved his physical health, but also reduced his psychological stress. Modern medical research shows that moderate masturbation is not only harmless, but is actually an important part of maintaining prostate health. Of course, excessive masturbation can indeed lead to problems, such as prostate congestion and fatigue, but the key is to strike a balance. To determine whether masturbation is excessive, consider the following. If you feel tired, have difficulty concentrating, or have back pain the day after masturbating, your frequency may be too high. If masturbation becomes a compulsive behavior that interferes with your daily life, you may need to adjust your behavior. If you experience discomfort with urination or vaginal pain after masturbation, you may have a prostate problem and should seek medical attention immediately. Your mental state during ejaculation is also crucial. Negative emotions such as tension, anxiety, and guilt can affect the balance between the sympathetic and parasympathetic nervous systems, potentially leading to difficulty ejaculating or discomfort after ejaculation. 20 minus 8 minus year minus old Mr. Son, raised to believe that masturbation was sinful, felt intense guilt and anxiety every time he masturbated, leading to perennial pain and discomfort during urination. Through psychological counseling and behavioral modification, he gradually overcame this psychological burden and his symptoms resolved. A partner's understanding and support are equally important for men's prostate health. I once met a 45 minus year minus old patient whose wife, suffering from long minus term abstinence due to low libido, had developed prostate hyperplasia BP. When I suggested he maintain regular ejaculation through masturbation, he felt embarrassed and resisted. Later, his wife took a consultation and explained the importance of regular ejaculation for her husband's prostate health. With her understanding and support, the patient began trying, and 6 months later, his BPH symptoms significantly improved. The serious consequences of ignoring ejaculation frequency. As a urologist, I encounter patients suffering daily due to neglecting their prostate health. Many people don't seek medical attention until serious symptoms develop, often missing the best time for treatment. Today, as a professional physician, I'd like to share with you the serious consequences of neglecting ejaculation frequency. First, long minus term inadequate ejaculation significantly increases the risk of prostatitis. A 30 minus year minus old Mr. Shu is a typical example. Due to his busy work schedule, he abstained from sex for a long time. He initially experienced only mild discomfort in his perineum, but ignored it until he developed symptoms such as painful urination and a fever. Examination revealed a significantly elevated white blood cell count requiring long minus term antibiotic treatment. Worse still, chronic prostatitis also lead to erectile dysfunction and premature ejaculation, severely impacting his quality of life. Second, infrequent ejaculation can accelerate the progression of benign prostatic hyperplasia, BPH. While BPH is a common condition among middle-aged and older men, the age of onset has been trending younger in recent years. 40-5 year minus old Mr. Wu was diagnosed with BPH after long minus term abstinence. His prostate had grown to 40 grams. Normal is about 20 grams, resulting in severe urinary difficulty and requiring him to wake up for 2-5 times at night, significantly disrupting his sleep. Due to limited effectiveness of medication, he ultimately underwent surgery. If I had known the importance of regular ejaculation earlier, I wouldn't have developed the condition requiring surgery. Most concerning is that chronic inadequate ejaculation may increase the risk of prostate cancer. While there's no direct evidence proving a causal relationship between ejaculation frequency and prostate cancer, several observational studies have found that men who maintain a higher ejaculation frequency do have a lower incidence of prostate cancer. 50-8 year old Mr. Zheng was diagnosed with advanced prostate cancer with bone metastasis after abstaining from sex for a long time. Despite aggressive treatment, his prognosis remains grim. He regretfully said, "If I had known earlier that regular ejaculation could reduce prostate cancer risk, I would have definitely taken this issue seriously." Beyond these direct physiological consequences, neglecting ejaculation frequency can lead to a host of psychological and social problems. The urinary symptoms and sexual dysfunction often associated with prostate disease can cause negative emotions like anxiety and depression, impacting work performance and interpersonal relations. 40 year old Mr. Keon, suffering from erectile dysfunction due to chronic prostatitis, began avoiding intimacy with his wife, leading to strained marital relations. He became withdrawn, his work efficiency declined, and he even developed mild depression. After comprehensive treatment and psychological counseling, his physical and mental condition gradually improved. A 10-year observational study of 5,000 men found that those who maintained regular ejaculation not only had a lower incidence of prostate disease, but also had significantly better overall quality of life and mental health than those with less frequent ejaculation. This suggests that ejaculation frequency is not only related to prostate health, but also impacts a man's overall health. Comprehensive strategies for maintaining prostate health. Prostate health cannot rely on a single approach. It requires comprehensive care. Having discussed the importance of ejaculation frequency, I would like to share some practical prostate health maintenance strategies to help you build a comprehensive prostate health system. Dietary adjustments are the foundation of prostate health. Studies have shown that certain foods have a special protective effect on the prostate. Lycopene in tomatoes is a powerful antioxidant that can reduce the risk of prostate cancer. It's recommended to consume 1 tomato or a moderate amount of tomato products daily. Pumpkin seeds rich in zinc and plant sterols help maintain prostate health. A small handful can be eaten daily. Furthermore, consuming more fish rich in omega-3 fatty acids, such as salmon and sardines, cruciferous vegetables such as broccoli and cabbage, and selenium-rich foods such as Brazil nuts and mushrooms are all beneficial for prostate health. Notably, a study published in BMJ Open in 2023 found that increased coffee intake may reduce the risk of prostate cancer. This 16-part prospective cohort study, which included 57,732 prostate cancer cases, showed that compared with drinking less than 2 cups of coffee per day, drinking 2 or more cups of coffee per day was associated with a 9% lower risk of prostate cancer. Each additional cup of coffee consumed per day was associated with a 1% lower risk. This suggests a new dietary option for protecting prostate health. Moderate exercise is crucial for prostate health. Prolonged sitting can lead to poor pelvic circulation and increase the risk of prostate disease. I recommend at least 30 minutes of moderate-intensity exercise daily, such as brisk walking, swimming, or cycling. I especially recommend pelvic floor exercises, such as Kegel exercises, which strengthen the pelvic floor state, improve blood circulation to the prostate. To do this, contract the anal and perineal muscles, hold for 3 to 5 seconds, and then relax. Repeat 10 to 15 times per set, 2 to 3 times daily. Maintaining good lifestyle habits is equally important. Avoid prolonged cycling or motorcycle riding, as this can compress the prostate and cause congestion. Don't hold urine. Urinating promptly reduces bladder pressure and reduces the risk of prostate infection. Maintain a regular sleep schedule and avoid staying up late, as lack of sleep can affect endocrine balance and increase the risk of prostate disease. Mr. Zhang, a 38-year-old long-distance truck driver, developed chronic prostatitis due to prolonged sitting and holding urine. I recommended that he stop every 2 hours to rest, urinate promptly, and do simple stretching exercises. These small adjustments have helped alleviate his symptoms. Regular physical examinations are crucial for prostate health. I recommend that men over 40 undergo an annual prostate exam, including a digital rectal exam and a prostate-specific antigen PSA test. Men with a family history of prostate cancer should begin regular checkups at age 35. Early detection of prostate problems is much more effective for treatment. 50-5-year-old Mr. Shenef resistant annual checkups discovered prostate cancer early. Thanks to the timely detection, he only needed regular observation, not immediate treatment, and his quality of life was not significantly affected. A large-scale prostate cancer screening program launched in Sweden in 2024 offers some insights. The program invited all men aged 50 to participate in a PSA test. Results showed that combining PSA with MRI screening effectively reduced the risk of overdiagnosis while increasing the detection rate of clinically significant prostate cancer. This suggests that regular screening is crucial for prostate health. Psychological adjustment is also crucial. Chronic stress, anxiety, depression, and other negative emotions can disrupt the balance of the autonomic nervous system and lead to prostate dysfunction. Studies have found that men with high work or family stress have a 1.2 to 1.5 times higher risk of prostatitis than those with less stress. I recommend relieving stress through meditation, yoga, deep breathing, and other methods, and seeking psychological counseling if necessary. Mr. Jia, 42 years old, suffered from recurrent attacks of chronic prostatitis due to work pressure. While taking medication, he followed my advice to learn meditation and deep breathing techniques. After 3 months, his symptoms improved significantly and his work efficiency also improved. Clarifying common prostate health misconceptions. I found that men have many misconceptions about prostate health. These misconceptions often lead to inappropriate health behaviors and even delayed treatment. Today, as a professional physician, I'd like to clarify some common misconceptions. Myth 1: more ejaculation is better. This is another extreme that many men tend to fall into. While regular ejaculation is crucial for prostate health, excessive ejaculation can lead to prostate congestion and fatigue, increasing the risk of inflammation. 20-8-year-old Mr. Son, believing that more ejaculation was healthier, masturbated to 2-3 times a day. This resulted in excessive prostate congestion and symptoms of chronic prostatitis. After treatment and frequency adjustment, his symptoms gradually subsided. Generally speaking, it's best for adult men to ejaculate 3 to 4 times a week, though the frequency can be adjusted based on individual circumstances. Myth: that masturbation causes impotence and premature ejaculation. This traditional belief is widely held among the public, but it's completely wrong from a medical perspective. Moderate masturbation not only doesn't cause sexual dysfunction, but actually helps us understand our sexual response patterns and can help prevent premature ejaculation. 30-year-old Mr. Xu, raised to believe masturbation was harmful, felt intense guilt after each session, which lead to psychological erectile dysfunction. Through psychological counseling and sex education, he gradually overcame this psychological burden and his sexual function returned to normal. Myth 3: prostate problems naturally occur with aging and cannot be prevented. Although the incidence of prostate disease increases with age, this doesn't mean we have to passively accept it. Lifestyle interventions such as maintaining regular ejaculation, a healthy diet, and moderate exercise can certainly delay or even prevent the onset of prostate disease. My 70-year-old patient, Mr. Wu, has maintained a healthy lifestyle and his prostate exam results are better than those of many 50-year-old men. The 2025 European Association of Urology guidelines also emphasize the importance of lifestyle adjustments for prostate health. Myth: for benign prostatic hyperplasia, a BPH will inevitably develop into prostate cancer. This is a concern shared by many middle-aged and older men. However, BPH and prostate cancer are two different conditions with no direct causal relationship. While the two can coexist, hyperplasia does not directly transform into cancer. After being diagnosed with benign prostatic hyperplasia, a BPH, 65-year-old Mr. Seng was extremely worried about the possibility of cancer and even refused treatment. After a detailed explanation, he accepted treatment and his symptoms are now well under control. Recent research shows that the pathogenesis and pathological characteristics of the two conditions are completely different, so there's no need for excessive concern. Myth 5: no symptoms mean no need for testing. Prostate disease often has no obvious symptoms in its early stages, and by the time symptoms become apparent, the optimal time for treatment may have passed. In particular, prostate cancer is often asymptomatic in its early stages, and by the time symptoms such as bone pain appear, it's often already in its late stages. 50-8-year-old Mr. Keon, who declined a physical examination because he felt no discomfort, was unexpectedly diagnosed with advanced prostate cancer during an unplanned examination. Sweden's prostate cancer screening program has shown that combined PSA and DIM-RA screening and detect clinically significant prostate cancer early, significantly improving prognosis. Myth 6: prostatitis is always caused by STDs. While some sexually transmitted infections can cause prostatitis, most cases are not related to STDs, are caused by a variety of factors, including bacterial infections, immune abnormalities, and pelvic floor muscle tension. 30-5-year-old Mr. Feng developed prostatitis, mistakenly believing it was an STD and was hesitant to seek medical attention, which worsened his condition. Later examinations revealed non-bacterial prostatitis unrelated to STDs. Clinical data shows that less than 10% of prostatitis cases are related to sexually transmitted infections. Protecting prostate health starts now. As a urologist, I've witnessed countless cases of men regretting neglecting prostate health. Today, as a professional physician, I share this crucial information about ejaculation frequency and prostate health. These insights may challenge your conventional wisdom, but they are based on the latest medical research and clinical practice and deserve every man's serious consideration. Prostate health isn't an elective to be considered only when problems arise. It's a mandatory course that should be taken from a young age. Maintaining a regular ejaculation frequency, combined with a healthy diet, moderate exercise, good lifestyle habits, and regular checkups, is essential for maintaining comprehensive prostate health. Remember, prevention is always better than cure. Don't wait until your prostate fails or becomes cancerous before regrets set in. Prostate health is like a bank account. It needs to be accumulated continuously. Don't wait until the need arises to save. I hope everyone can develop a comprehensive understanding of prostate health, apply what you've learned today to your daily life, and take responsibility for your prostate health. Your future will surely thank you for making the right choices now.